Good afternoon. I'm Jerry Yuki, founding dean of the University of South Carolina School of Medicine, Greenville, and it's my pleasure and privilege to preside over the ceremony this afternoon. I would ask all of you to please silence your cell phones, and I would ask all of you to refrain from flash photography during the ceremony. There is a professional photographer here, and those pictures will be made available to you at our website. We're going to start with an invocation provided by Reverend John Hartman, our senior chaplain from the Greenville Health System. John? Everyone please stand.
I invite you to bow your heads with me for the invocation. O Holy One, we gather today to pause and celebrate the donning of white coats on our new medical students. In doing so, we ask your blessing upon them on their road to becoming not just physicians, but healers. May they discover the knowledge to see illness and healing in ways they have heretofore not seen it. May they develop the skills and competencies to put into practice what they discover and learn. And may their achievements match and even surpass those of their teachers and mentors. When they lose their way and believe that they stand alone as healers in the face of the monsters of disease, remind them that they are never alone. Remind them that they always exist as a part of a community of healers. Remind them that even in the world of medical science, there is always the unknown and the uncontrollable. May this knowledge spur them to new humility and to new discovery and hope. All that they may know that the journey is the destination. In your holy name we ask these things. Amen.
Thanks, John. Everyone please be seated. Parents, grandparents, faculty, staff, board members, administration, supporters, friends, and students, welcome to the 6th University of South Carolina School of Medicine Greenville White Coat Ceremony. Soon you will meet the class of 2021 as they don their white coats and walk across the stage, signifying their completion as the only medical students in the country who complete EMT training and their entry into the rigors of the modern medical school classroom. I'd like to start this by introducing my platform party seated behind me. In the front row on the left is Dr. Spence Taylor, Greenville Health System President. Next to him is our speaker, faculty speaker, keynote speaker, Dr. Stanley Von Hoff. Dr. Catalana to your left, my right, my Associate Dean for Student Affairs and Admissions. Dr. Angela Sharkey, Associate Dean for Academic Affairs. Chris Esposito, whom I'll introduce in just a minute. In the back row, behind Dr. Von Hoff, is Kristen Lacey, our Executive Director for Business Operations. Dr. Brenda Thames, GHS Vice President for Academic Development and Provost. You met my friend John Hartman a minute ago. And then next to him is Dr. Rick Hodinka, the Chair of the Biomedical Sciences Department of the Medical School. Chris Esposito was elected by his class to provide the student address. He is the president of the class. Chris hails from Connecticut. We were visiting beforehand. He went from Connecticut to Temple, where he played football for a period of time, and then transferred to the Citadel. His leadership skills are obviously apparent to this class already, and it's our pleasure to have him provide the student address. Chris?
Thank you, Dean Yuki. Welcome, family and friends, to this year's White Coat Ceremony. Before I get started, I do want to say one thing. Neither my mother or my father knew I'd be speaking today, so I'm very grateful my classmates are EMT certified, because they may or may not be in shock right now, but roughly 830,000 students applied to medical school for the 2016-2017 application cycle. Out of those 830,000 students, approximately 21,000 were accepted into medical school this year. Math is certainly not one of my strong suits, but with a little bit of number crunching, I believe that comes out to about 2.5%. I bring this up not to boast, but to rather emphasize how incredibly humbling it is for my classmates and I to be a part of the 2.5% of students receiving a white coat this year. Today marks a special transition point for the class of 2021. Our acceptance of this white coat symbolizes an ongoing commitment to the field of medicine. It is a commitment that entails a lifetime of learning and growth. Later in the ceremony, my classmates and I will recite an oath. This oath cannot be found on Google or in a book. It is an oath that was written by us as a class. Rather than discuss the meaning behind the coat, as I'll leave this responsibility to us as a class when we recite our oath, I'd like to take the next few minutes to talk about what makes our white coat in particular so special. USC School of Medicine Greenville is a different school of thought. It became apparent to me from the moment I stepped on campus for my interview. I'll never forget pulling in the parking lot and seeing a sign in one of the spaces that said reserved with my name on it. It was a simple gesture, but the comfort it provided me prior to the interview really meant a lot. After speaking with many of my classmates about their interview experiences, I think they would agree with me when I say USC Greenville made us all feel like we belonged here. Let's now fast forward to the first day of medical school. I remember sitting in the lecture hall with my classmates. I didn't know whether I should be excited that the day had finally come or horrified that academic hazing was upon me. Dr. Catalana, our Associate Dean for Student Affairs and Admissions, quickly shifted my emotions in the right direction. I remember him saying, "I want everybody to look to their right, everybody to look to their left. Both of those people will be there with you when you graduate in 4 years." It was in that moment I realized I made the right decision to attend USC Greenville. This school is a special place, and I wouldn't want to receive my medical education anywhere else. The emphasis our faculty places on integrating the practice of medicine into our curriculum is unrivaled. For those of you who are not familiar with the EMT program, we're the only medical school in the country that requires its students to become EMT certified. Throughout the module, my classmates and I were required to complete 10 separate patient interactions while riding along with local EMS units. On one end of the spectrum, I remember hearing about one of my classmates bringing a middle-aged man's heartbeat back after he underwent a stroke prior to the EMS's arrival. This is an example of a happy story. On the other end of the spectrum, I remember my roommate telling me about a child abuse call he ran. He ran a child abuse call, and when he arrived at the scene, he glanced into the house. He saw nothing but bugs. A child was living in the bug-infested house with no food, water, or electricity. So many bugs had gotten into the truck during the transport that the truck needed to be decommissioned for the day, and the paramedics were sent home. Instances like this show a rawness to humanity that just cannot be read in a textbook or lectured in a classroom. Another unique component of our curriculum is a class called IPM, which stands for Integrated Practice of Medicine. It is in this class that we learn how to do practical skills like doing a physical exam, using ultrasound, taking a proper medical history, and most importantly, communicating with our patients. 2 weeks ago, our class had the privilege to hear from 3 mothers who all delivered a baby with Down syndrome. They educated us from a mother's perspective on what it is like to receive the news of the diagnosis. Up until that point, I had never put much thought into how I would actually deliver such news to a patient. Learning opportunities like this are what make this school so special. There are so many unique components to our school that make it a different school of thought, and while I wish I could share all of them with you, there's just simply not enough time to do so in a 10-minute speech. But before I hand the podium over to Dr. Taylor to introduce our keynote speaker for today's ceremony, there are a few things I'd like to say on behalf of my classmates. To the faculty and staff, thank you for taking a chance on us. It's humbling to think that of the 4,000 applications you received last year, you chose us to represent the class of 2021. We as a class will forever be grateful for the opportunity that you have given each one of us. To the family and friends in attendance today, Words cannot describe the love and appreciation we have for all of you. When we were struggling to get through that tough undergraduate class, the dreaded MCAT, or just the application process as a whole, it was you that pushed us through. Thank you for your patience and support throughout the years. We as a class hope you know that today would not be possible without each and every single one of you. And lastly, to my classmates, thank you for making the first 2 months of medical school everything I thought it would be and more. It's humbling to be a part of such an intelligent and diverse group of individuals. Artists, musicians, former collegiate athletes, military officers, writers, the list goes on and on. I'm so grateful that pursuing a career as a physician allowed our paths to cross in Greenville, South Carolina. Medical school will challenge all of us in ways we never thought we could be challenged, and there will certainly be times when we feel like the finish line is nowhere in sight. But remember this, we are not a class of 105 individuals. We are a class that operates as one unit, a class that looks out for each other, and a class that will go out of our ways to make sure everybody crosses the finish line together. My hope for the class of 2021 is that we're not solely remembered for our ability to score well on tests or pass the board exams, but rather as a class that is remembered for having honor, integrity, compassion, humility, and respect. Thank you. At this time, I'd like to introduce President Taylor to the podium.
Thank you, Chris. That was outstanding. My name is Spence Taylor. I'm the president of Greenville Health System. I'm also the founding senior associate dean for academic affairs and diversity. And it's just a great pleasure to see this crowd here today and these students. And I want to be one of the first to congratulate you on your white coat ceremony. It's something to really be proud of. As you parents know, or maybe don't know, there were probably more than 4,000 applications. That's 40 to 1 to get into medical school. That's pretty amazing. So congratulations. It's something that you ought to celebrate. I have the distinct privilege and honor to introduce our keynote speaker today. It was interesting. Back when we were putting the medical school committees together in 2009, it was a group of intense people that were working pretty hard on the project. And it was curious to me as who in this community would actually emerge and embrace the medical school from the medical staff that we have. And what we pleasantly found that there was a group that really embraced, that really didn't have anything to do early on with the ideas, but it really made all the difference in this medical school. Names like Tom Pace, Lauren Demosthenes, for example, come to mind. And this is one of them, and it's Dr. Stanley Von Hoff. Dr. Von Hoff is an endocrinologist and an internist and has been in Greenville for many years. He was born in Greenville, graduated from Clemson University in 1967, went to medical school in Vanderbilt, the School of Medicine there, then did his internal medicine residency at the University of North Carolina. He owed a military obligation and actually went to Wilford Hall, Lackland Air Force Base, where he was there, did a fellowship in endocrinology and followed up by his active duty, and then came to Greenville in 1978, where he has been in some aspect of internal medicine care, teaching, endocrinology care for the past 30 years or so. It's been my great pleasure to have called him a colleague for the past 25 years. When I came here, also from Wilford Hall at Lackland Air Force Base, in 1992, it became apparent that there were really a group of really high-class physicians, and Stan Von Hoff, without question, was one of those individuals. It's an interesting phenomenon. I know that the vernacular and some of the slang we use in medicine is a little bit of an inner circle, but has anybody ever heard of a person called a flea? Am I never a flea? A flea is somebody that an internist, we used to appropriately call the internists fleas if they're really, because they jump all over people and they know more about that patient than anybody else. And it's a term of endearment. And it really, really is. The guy that knows more about the patient than anybody, those are the internists. And Stanley Von Hoff is probably one of the best internists and a true flea in a really wonderful way. And it became pretty apparent when I was practicing as a young surgeon in this community that he was one of the best doctors that we basically had. His notes were always immaculate. You absolutely would read them because it was always you were afraid of that diagnosis that Dr. Von Hoff found that you didn't find. And so it was really quite amazing to see. And then when Dr. Von Hoff became more involved in medical school, it was just huge flattery to all of us that were in the group that helped start the medical school. He's won many, many awards. He's been recognized by his peers. He's been recognized by students. He's been recognized by the residents. His most recent award is the Excellence in Teaching Award in 2017, named by the senior class last year. He's not only a great physician, but just a real profile in personal courage, and he's has been on the other side of the doctor-patient relationship, and perhaps he'll share some of that with us. But he is a terrific person to address the class for the White Cliff ceremony, and without further ado, I'd like to ask Dr. Von Hoff to please come to the podium. Thanks.
Thank you, Dr. Taylor, and thank you, Dr. Catalano, for inviting me, and Dr. Yuki for giving me the honor of talking to you. It's quite an honor, and I am a flea, and I'm going to get all over you today. So, a good doctor. I reviewed several YouTube videos of prior white coat ceremony speakers to see what I'd gotten myself into. Oh my gosh. And that was before I heard Chris. So bear with me. I'm going to speak to you as a clinician. To get some advice on what to say today, I asked one of the upper level students what she thought I should say to you. And her reply was, keep it clean. And I sort of did a double take, and I said, what? I said, are you talking about what I'm saying? She said, no, I'm talking about the white coat. So I figured after that, what can I tell you? That's the best advice you're going to get today. Last week, on the front page of the Greenville News, there was an article entitled, Doctors Spend Half Time on Electronic Records Work, Study Finds. This was from the University of Wisconsin in Madison, and it was published in the Annals of Family Medicine, and it was a study, I think it went over 3 years' time, of determining how physicians use their time. And they found that of 142 physicians, that they indicated they spent 45% of their workday on the electronic medical record, which, by the way, is the same system we have here in our system. It's the Epic, for what that's worth. This situation led to a life-work imbalance, dissatisfaction, high rates of attrition, and burnout rates exceeding 50%. Now, my background is in clinical medicine, as I said, and I want to speak from my experience as a clinician and a teacher. And I want to try to give you some practical information as you start interacting with patients and actually doing physical exams. So I'm specifically going to talk about the physical exam today, and I'm going to tell you why I chose this topic. So you might say, well, what does that have to do with this newspaper article? Well, I think it has a lot to do with it because this article is about technology, and I think we've reached a tipping point in medicine where we've allowed technology in some aspects to sort of dictate what we do with our time. And so I think that is an issue. I'm not going to attack technology today, but I am going to tell you that we can't continue to allow this to displace our focus on patients. Now, another factor that I think enters into this business about physical exam and patient interaction is poor teaching. I've been around long enough and have worked with enough physicians in the community, residents, students from other schools perhaps, and I'm thinking, who taught you? How did you get out of medical school? Something's got to be done about this, and Dr. Taylor talked about when we were, I wasn't actually in on the organization of this school, but I did know enough about it that I remember meeting with Spence one day in the cafeteria and telling him I wanted to be involved in teaching here. And one reason I wanted to do that was because I felt strongly that we need to get students at an early stage and bring them up right. If you wait until they're residents, it's already too late. So that's one reason I wanted to get involved with this school in particular. Now, I recognize the importance of a patient's history, and some doctors in the audience would say, well, that's the most important aspect of the interaction with a patient, and we could argue that. But the problem, I think, is with doing physical exams or not doing them. I'm involved in the courses IPM 1 and 2, clinical skills, and I'm going to be one of the doctors teaching you the history and physical exam. So I want to get you started on the right foot. Now, what I've done here, and I'm not going to talk all day, so bear with me. This won't be long, but I've chosen 6 clinical scenarios here to illustrate my point about what we're not doing with physical exams. So the first scenario is a 38-year-old woman seeing me, an endocrinologist, and endocrinologist, for those of you who don't know, is we specialize in the endocrine glands, hormone therapy, and that kind of thing. So I'm a consultant, and I'm seeing this patient on a 3-month follow-up for hyperthyroidism, overactive thyroid. I notice her blood pressure is 160/98. So I asked the lady, well, what does your primary care doctor say about this? And her quote, or close to it, was, I've seen her twice in the past 6 months, and she didn't touch me on either visit. A good doctor would touch the patient, check the blood pressure herself, and do a cardiovascular exam. Scenario number 2. A 50-year-old woman is admitted to the hospital for hypotension, that's low blood pressure, fainting. She's managed initially by the house staff with intravenous fluids and medications. On attending rounds the following morning, during the exam, the attending notes this lady doesn't have any pubic hair. She's pale. She doesn't look right. And so the attending, who happened to be me in this case, so these are all real cases. I didn't make these up. And I don't blame doctors for misinterpreting something like this. This is an uncommon situation. But I do blame them for not looking. And this happens to be a sign of hypopituitarism, an underactive pituitary gland. Well, it so happens, lo and behold, this lady had a pituitary tumor and had been on medication, and it had been inadvertently stopped several months back. Now, had they known that, they could have put her back on her medications and certainly shortened her hospital stay and maybe even saved her life. A good doctor would examine the whole patient and at least ask the question, even if you don't know what does this mean, why no axillary or pubic hair? Scenario number 3. A woman presents to the hospital with cough and fever, examined by internal medicine residents. Treatment for pneumonia has begun. The following morning, on rounds, again the attending lifts up the patient's gown to examine the chest. She's got an inflammatory mass in the right breast. This had not been mentioned to the attending because no one did an exam of the anterior chest prior to attending rounds and prior to the patient presentation. A good doctor would complete the chest and lung exam, including a chaperone breast exam if appropriate, and wonder why the patient wouldn't bring this up in the history. Scenario number 4, 68-year-old man comes to his primary care MD for follow-up of hospitalization for pneumonia. His physician listens to his lungs, says, well, they sound pretty clear. So he's satisfied with that, but this physician also palpates his abdomen, which is routine with this particular doctor. He examines the patient. Well, lo and behold, there's a pulsatile mass in his abdomen. Further workup of this reveals this patient has an abdominal aortic aneurysm. The patient either had not been examined completely while in the hospital for pneumonia now, or else whoever did the exam obviously missed it. A good doctor would do a complete chest and lung exam, including, the good doctor would examine the whole patient in this case. The fifth scenario is a 52-year-old woman who's seen in the ER for sudden onset of leg weakness and inability to walk. Although a neurologic problem is suspected, like a stroke, possibly something worse, no one does standard components of the neurologic exam, as in using this instrument, which you'll learn about, an ophthalmoscope, to look in the back of the eye to see if there's increased pressure on the back of the eye and thus increased intracranial pressure, or a Babinski sign, which is stroking of the foot. These are basic elements of a physical exam, but nobody did it. A good doctor would do a complete neurologic exam. Finally, 72-year-old male physician who happened to be a classmate of mine from medical school had a pre-op evaluation, a physical exam by his primary care physician in preparation for 2 separate operations. So he had 2 separate examinations. On neither exam was he examined appropriately. The physician listened to his lungs and heart through his clothes, palpated his abdomen with his clothes on. A good doctor would examine the patient with his clothes off and appropriately gowned. Now, as I stated, these are all true stories, and just a few of a number I've either witnessed or heard about. With all these scenarios as background, I want to tell you about 3 exemplary and revered medical educators and what they had to say about the physical exam. First one is Sir William Osler, who many of you probably have heard of. He's considered by many to be the father of modern medicine. He lived about 100 years ago, and although 100 years is 100 years, his teaching are as relevant today as they were then. One of his students said he performed an incomparably thorough physical examination. Dr. Osler, interestingly, sought to reduce didactic lectures, which you guys are going to be complaining of before too many more weeks, probably. It's universal. It was present when I was in medical school. It goes on, but it's hard to get around. But anyway, Dr. Osler wanted to get away from that and teach at the bedside. One of his quotes was, "He who studies medicine without books sails an uncharted sea, but he who studies medicine without patients does not go to sea at all." He felt so strongly about teaching medicine at the bedside that he wanted the epitaph on his tombstone to read, "I taught medical students in the wards, as I regard this as the most useful and important work which I've been called upon to do." A second exemplary physician is Abraham Verghese of Stanford Medical School. He is the author of Cutting for Stone and In My Own Country. And if you haven't read those, I would highly recommend them. I've read Cutting for Stone. It's a great book. He's also a featured teacher on the physical exam on the internet site Stanford Medicine 25, promoting the culture of bedside medicine. Dr. Verghese, in an article published in the American Journal of Medicine, December 2015, along with his co-authors, surveyed about 5,000 physicians of diverse specialties with an 11-question qualitative survey in order to assess inadequacy of the physical exam as a cause of medical errors and adverse events. They collected 200 vignettes which fulfill the criteria of their questionnaire. Their findings showed that 63% of these cases, there was a failure to perform the exam. So it's not a matter of they did it incorrectly or they misinterpreted it. 63%, so out of 208 cases, that's roughly 120, 130 cases where nobody did the exam. That's unacceptable. This is why I want to talk to you today about this as a clinician. 14% of the failures were that the correct physical exam was done, but it was misinterpreted. 11%, the relevant sign was not sought. Now, the consequences of all this showed that there was a missed or delayed diagnosis 76% of the time, and 25% of the time there was an incorrect diagnosis. Delayed treatment in 42%, unnecessary diagnostic tests 25%. So you see, there's more to this than just not doing the exam. There are repercussions from this. Now, perhaps more important than anything I'm going to tell you today is a YouTube video by Dr. Verghese. And I would encourage everybody here to just crash the website, YouTube, and look at this video. Even if you're not a physician or a student, this guy's an outstanding speaker and author. This video is on, if you go to Google TED.com, it's a TED Talk. It's titled A Doctor's Touch by Abraham Verghese. It's outstanding. It's 18 and a half minutes long, and you'll really miss something if you don't view that video. All right, so the third person I want to tell you about is a physician I had at Vanderbilt Medical School. He made a profound influence on numerous students and residents at Vanderbilt. His name was Thomas Brittingham, better known as TEB, as he was affectionately known by his students and residents. One of his most meaningful quotes was, "The patient is always right." And I've often tried to understand what he meant by that, and I think what he meant was the patient knows what he or she has ultimately, or has an understanding. It's up to you, it's up to us as physicians to get it out. But a peer who knew Dr. Brittingham early in his career described him as the most careful and thoroughly fair man he had ever known. As third-year students presenting to Dr. Brittingham on Saturday morning, notice I said Saturday morning, at a conference where we presented patients to him and he went through the case and discussed it, it was understood we'd really better know this patient because Dr. Brittingham was known to travel to other hospitals to review medical records on the patient to be presented. He knew ahead of time who it was. He even reportedly went from Nashville to Chattanooga one time to review medical records in a hospital there. His legacy remains alive in stories still told by his students and residents, as illustrated by the following ditty. John Sargent, who's actually visited this school, was a former student of Dr. Brittingham's and later to become an attending at Vanderbilt. John recalled late one evening when he was in his internship at Johns Hopkins. He had just admitted a female patient and was writing her up, and he realized that he had forgotten to do the pelvic and rectal exam. So he was about to write on the chart, pelvic and rectal deferred till AM, when he developed this irrational but burgeoning fear that TEB would somehow come to Hopkins, would read his workup, and would be disappointed in him. So he got the patient up in stirrups at 2 a.m. and did the pelvic. Today, medicine has become highly dependent upon technology and in the patient evaluation and treatment, the availability of the electronic record and modalities such as CT scans, MRIs, ultrasounds, just to name a few. There seems to be a tendency of some physicians to focus on or rely upon them to the exclusion of hands-on examination of the patient. There are also demands placed on physicians to see more patients, be more productive, check the box, fill out the template on the computerized medical record. We're under great pressure to follow best practice guidelines and algorithms and to check off the right boxes in order to justify billing codes. We should look upon advances in technology and computerized records for what they are, in many ways of great benefit to patient care. But I hope you will take to heart the patient scenarios and words and examples of great teachers that I've presented today and take a pledge that you will first and foremost learn how to perform a good physical exam and make its performance a must-do in your careers as physicians. Remember, a good doctor examines the patient. Finally, I want you to be able to appreciate some excitement in medicine. Now, this may sound ominous to you, all this business talking about physical exams, what doctors miss, what they didn't know. This should be fun. The courses I'm involved with absolutely should be fun, but my medical school career was the most fun. It was outstanding. I want it to be that way for you guys. There's a lot of pressure, but unless you really screw up, you're gonna graduate. And we've sort of preempted that happening by choosing you as we did. So try to have some fun. And even though I want you to be able to experience what I call the eureka moment. And what is that? Well, as physicians, we deal with serious issues of patients' health. Even though we do, there's no reason not to get excited about being the first to hear the murmur of aortic stenosis, recognize possible Cushing syndrome from the physical appearance of the patient, or detect papilledema from looking in the back of the eye using an ophthalmoscope in a patient with a headache. Just to know that you discovered this abnormality and how your discovery may impact the patient's health, hopefully in a positive way, is somehow to me sublime without equal. And I hope you can experience medical school and your career in that light. Thanks again for the opportunity to speak to you today. Good luck as you start your career. I look forward to being a part of your education and learning with you. I'm still learning. Thank you.
Ladies and gentlemen, before we present the students, I couldn't help but take a moment to emphasize to you what a singular experience you've just had. You've heard from three exceptional people here this afternoon. Christopher D'Esposito, exceptional to the point that what we believe is one of the most outstanding entering medical school classes in America, chose him to represent you. Spence Taylor, my friend, who most of, I guess, in the audience probably wouldn't know this, in 2010 resigned as chairman of surgery in the Greenville Health System to become a maniac on a mission. He is the man that wrote the founding documents establishing this medical school, and then exceptional to the point where he was chosen as the first physician president of the Greenville Health System. And Stanley Von Hoff, that you just heard from, after a 50-year career, is a role model for the medical students sitting in front of you, and has been chosen by us, obviously, to put him in front of you to talk to you. So don't lose sight of what a singular moment this was to hear from these three exceptional people. Now, joining me up here, Paul Catalana, our Associate Dean for Student Affairs and Admissions, will present the students. Our Senior Associate Dean for Academic Affairs, Angela Sharkey, will help the students don their coats, and I'll be part of the photo op. So here we go.
Will the students begin to line up, please, for the ceremony? Thank you. While they are lining up, I too want to share my greetings to family, friends, and loved ones. I know some of you are familiar with Greenville. Perhaps some of you are here for the first time, but welcome indeed. I will call everyone's name. Dr. Sharkey will put their coat on. They'll walk across here, and Dr. Yuki will greet them as well. We would ask, please, that you refrain from applause until the very end, and then I promise you we'll have plenty of opportunity to congratulate the class of 2021. Let me also say this. You've heard on multiple occasions that we had 4,300 plus applications this year. And you may wonder, how in the world do we choose from that number? We choose it because I work with a wonderful, wonderful group of people. But I also want you to know that your loved ones are here not because they're smart. Of course they are. They've done well in terms of GPA. They've done well in terms of MCAT. What makes this group special and what allows people to be admitted to this school is the interview. And the interview essentially ignores one's grades and ignores one's MCAT. And what we look for are individuals that Dr. Von Hoff mentioned many, many times, individuals who are careful, individuals who are committed, individuals with communication skills, interpersonal skills, a passion for medicine, and most importantly, compassion for their future patients. Because when you think about when you leave a physician's office, what do you complain about? They didn't listen to me. They took no time. They seemed to ignore me and stare at the computer screen, et cetera, et cetera. I'm happy and I'm confident to say that your loved ones have a real chance to change that. And hopefully, when their patients leave their offices, they'll be talking about their passion and compassion, their listening skills, their communication skills, along with the care that they provide. So you need to be extraordinarily proud of those that are here today, and we thank you for all that you have done to contribute to the fact that they're here today, and we thank you for sharing them with us and allowing all of us, many of whom are sitting down here to my left, who will participate in their education and allow them to move forward. So thank you. You also should be happy about this. When I was running out of the house to grab their names, I actually grabbed the church bulletin from this morning and was coming down my road when I suddenly realized that that won't work. So I ran back home to get their names. And are we ready? And we're ready, and I will do my very best to pronounce them. And we'll start with William Abel. We're off to a good start. Arman Ahmed. Dorothy Askins. Brianna Baginski. Michael Baker. Oluwakemi Balagoon. Julie Barton. Thomas Perrault. Jessica Bigner. Thomas Blackwell. Rebecca Bowie. Addison Brandt. Stephanie Burley. Andrew Browder. Taylor Brown. Connor Brunson. Hallie Bryant. Brittany Butler. Alexander Buttress. Matthew Churich. Samuel Collingsworth. Nicholas Colecchio. Michaela Conley. Kiko Cooley. Joseph Chrisman. Samantha Cuff. Jasmine Dennis. Christopher D'Esposito. Victoria Dillard. Robert Eager. Jessica Edenfield. David Inyart. Connor Evans. Caroline Faircloth. Madison Ferguson. Allison Fedrick. Danielle Godfrey. Alyssa Goebel. Kelly Gross. Taylor Harris. Sandra Hedrick. Edwin Holt. Ariel Houston. Alexander Howard. Margaret Huggins. Irij Iftikhar. Lindsay Ina. Dylan Isaac. Jared Jackson. Emmanuel Jackson. Allison Johnson. Lauren Jones. Matthew Cavalis. Aaliyah Keels. Cheyenne Lowry. Andrew Larson. Abigail Lauder. Megan Lee. William Lorenz. Claiborne Lucas. Quentin Meadors. Krupa Merchant. Haley Miller. Sean Moore. Carson Mostert. Joshua Mushatelli. Tarek Namuz. John Naselli. Cameron Nolan. Michael O'Brien. Shauna Owen. Russell Pace. Shiv Patel. Alexandria Penwell. James Frederick Pike. Emily Polly. Dr. Sharkey, was that a wardrobe malfunction? There. Caitlin Purvis. Zachary Reynolds. Rebecca Ridgway. Jacob Ritchie. Eric Robles. Karen Rothier. Jennifer Rutt. Jennifer Santos. Katie Scholas. Emily Schumann. Tyler Seckel. Misha Sharif. Kelly Shell. Brenton Sinopoli. Megan Standridge. Renee Stullock. Robert Summers. John Sweetenberg IV. Jessica Tesney. Francesca Tashi. Jonathan Vandenberg. Julie Vanderberg. Jennifer Vassy. Brittany Walker. Ikra Wani. Amali Weems. William Weibley. Matthew Wessinger. Nikki Westbrook. Please help us congratulate the class of 2021.
Outstanding. Looks like almost doctors are ready, just 4 years to go. So next in our ceremony, Christopher will return to the podium, and he will lead the administration of the oath. As he mentioned to you earlier this evening, or this afternoon rather, the class writes their own oath, and so part of the advantage actually of the EMT training, besides getting the class together, a number of other things that are terrific in terms of bringing the class together and making them precocious, quite frankly, is they have the time to put together a meaningful oath. It's on the back of your programs. Chris, come on up and lead them.
Classmates, repeat after me, please. Oh, stand up, I'm sorry. Today I accept the honor and responsibility presented to me as I don this white coat. I wear it as a symbol of my ongoing commitment to the field of medicine The promises I make today lay the foundation for the physician I strive to become. With this oath, I vow not only to do no harm, but also to do good. I vow to pursue a lifetime of learning and growth, recognizing the dynamism of medicine. I acknowledge the contribution of my patients and peers in my learning, as each encounter represents an opportunity to expand my perspective, perfect my practice, and return to the fundamentals of medicine. I vow to support and champion my patients, serving as their educator, investigator, partner, and agent of wellness. I will connect the ideals of academia and advocacy, giving them an emotional and physical incarnation in my patients' lives. I will be an advocate that stands beside my patients, preserving their autonomy and promoting their health. I vow to actively advance patient quality of life, understanding that population health is a result of individual lives. I will remember that health is profoundly influenced by my community and access to care. I will use the responsibility granted to me as a physician and steward of my community to promote patient equality and further public health. I vow to serve people both locally and globally, refusing to perpetuate discrimination. I will have the courage to act in the presence of injustice. I commit to emphasize the patient rather than the disease by prioritizing individuality in my practice. I promise to remember the cornerstones upon which medicine rests, those of service, compassion, diligence, and humility. I vow to maintain longevity of spirit. I will pursue mindfulness through commitment to the present, consideration of yesterday, and conviction for tomorrow. I will embrace differing perspectives and share my own with empathy and patience. I pledge to care for myself and seek help, for I am my first patient. I take this vow for myself, my patients, and my peers. I will honor and uphold its tenets, for medicine and society will change, but this remains constant. It is a privilege to walk through someone's illness with them. Thank you. You may be seated.
Thanks to the students for going through the oath with us. Those of you in the room have now been party to what I consider to be one of the three most meaningful and significant ceremonies in medical education, certainly in this country. Truly, it is a privilege to walk through someone else's illness, and this does lay the foundation for the physicians that these young physicians in training strive to become. Please join me in one more round of applause for the class of 2021. So that ends the ceremony. What I would ask is the audience remain seated until the students and the platform party is exited. And then please join us in the lobby and outside for refreshments, photographs, and for congratulating these excellent young students that are here with us today. Thank you.